Hey there, and welcome to the KenkoVibe podcast. I'm Ethan Reed, so glad you're joining us today.
And I'm Grace Morgan.
We're diving deep into a topic today that might be considered a little, shall we say, delicate?
Yeah.
We're talking about penile prostheses,
Uh-huh.
which, as you may know, are a treatment option for men who are dealing with erectile dysfunction.
That's right.
So if you or someone you know is facing this challenge, this deep dive could be really eye-opening.
Absolutely.
We'll uncover how these devices work, what the experience is actually like, and how effective they really are.
It's a subject that I think a lot of men might feel a little hesitant to talk about.
Yeah, for sure.
We're here to give you clear, accurate information
Yeah.
in a way that's easy to understand.
Absolutely. No judgment here, just facts and insights.
Right.
So let's just kick things off by addressing the elephant in the room.
Okay.
What exactly is a penile prosthesis?
So in the simplest terms, it's a medical device that's surgically implanted into the penis to help men with ED achieve and maintain an erection. There are two main types: malleable, which basically means bendable,
Got it.
and inflatable.
Okay, so two different approaches. Are they equally popular, or is one preferred over the other these days?
Malleable implants were more common in the past, but inflatable prostheses are gaining popularity,
Interesting.
and for good reason.
Okay,
They offer a more natural feel and greater control over the erection.
that makes sense.
Yeah.
Okay, so let's delve into these inflatable prostheses then.
Right.
How do they actually work? What's going on in there?
So imagine this. The most common type is called a three-piece inflatable prosthesis.
Okay.
It's got a few key components. First, you have two cylinders that are implanted inside the penis.
Okay.
Then there's a reservoir that stores saline solution,
Yeah.
and a pump that's placed discreetly in the scrotum.
Okay, I'm picturing it.
Yeah.
So the pump is the key to making this whole thing work.
Exactly. Think of it like a hydraulic system.
Okay.
When a man wants to achieve an erection, he uses the pump to transfer that saline solution from the reservoir into the cylinders. This inflates them, creating the erection.
Got it.
And when he's done, there's a release valve on the pump that sends the fluid back to the reservoir, deflating the cylinders.
Wow, that's actually pretty ingenious.
It is.
So it's all controlled manually. What about that two-piece version you mentioned earlier? How
Right.
does that differ?
So with the two-piece option, the reservoir and pump are combined into a single unit
Okay.
within the scrotum.
That
This can make the surgery a bit simpler,
makes sense.
but it might not be suitable for everyone.
Interesting. So what factors might influence whether someone's a good candidate for the two-piece versus the three-piece system?
Well, the three-piece system generally provides a firmer and larger erection because it has a larger reservoir to work with.
Okay.
But as I mentioned, the surgery is a bit more complex.
Yeah.
The two-piece system is a simpler implant procedure, but might not achieve the desired results for everyone.
Right.
Really depends on individual anatomy and preferences.
Okay, so it's a bit of a trade-off.
Yeah.
A conversation to have with your doctor, for sure.
Definitely.
Now, I'm sure there are a lot of guys out there wondering about the aesthetics of it all.
Sure.
Is the implant noticeable? And what will sex actually be like with a prosthesis?
These are great questions.
Yeah.
First of all, the prosthesis is designed to be discreet.
Okay.
The scar is small and typically hidden in a natural fold of skin.
Gotcha.
When it comes to sex, the implant creates a firm and rigid erection
Uh-huh.
that feels very similar to a natural one.
That's reassuring, but what about sensation and the ability to orgasm?
Yeah.
Are those affected in any way?
So the good news is that the prosthesis doesn't interfere with the nerves responsible for sensation
Right.
or the ability to reach orgasm. Ejaculation is also not affected.
Wow.
So the experience is intended to be very natural feeling.
That's essentially, it's like hitting the reset button on erectile function, allowing men to regain that intimacy they might have been missing.
That's a great way to put it.
Yeah.
It's all about empowering men to enjoy a fulfilling sex life again.
That's incredible.
Ah,
But let's be realistic. It is surgery.
right.
Any surgery comes with potential downsides.
Of course.
Can you talk about the risks or complications associated with this particular procedure?
Absolutely. Transparency is key.
Yeah.
Like any procedure, it does come with some inherent risks.
Sure.
These can include the possibility of infection, bleeding,
Okay.
and in rare cases, mechanical problems with the device itself.
Got it.
This is why it's so crucial to have a frank conversation with your doctor beforehand
Yeah.
to fully understand the potential risks and benefits.
Okay, so open communication with your healthcare provider is essential.
Yes.
Now, another question that's probably top of mind for many is insurance coverage.
Sure.
Will insurance typically cover this procedure?
That's a great question. Insurance coverage can vary quite a bit, but often Medicare will cover the surgery.
Okay.
However, coverage under Medicaid can differ significantly from state to state.
Right.
So it's always best to check with your insurance provider.
That makes perfect sense. Now we discussed the mechanics and the potential risks, but let's talk about how effective this treatment actually is.
Right.
What kind of success rates are we looking at here?
Well, the research paints a pretty promising picture. Studies have shown that inflatable penile prostheses boast high success rates,
Doug.
with numbers ranging from 90 to 95% in achieving erections suitable for intercourse.
Wow, that's fantastic.
But what's even more encouraging is the high level of satisfaction
Yeah,
reported by men who have undergone this procedure.
that's fantastic to hear. So for someone considering this option, what are some key takeaways they should really keep in mind?
I would say the most important thing is to remember that it's a safe and effective treatment for ED backed by solid research. The second key takeaway is to have those open and honest conversations with your healthcare provider.
Okay.
They can help determine if it's the right choice for you, taking into account your individual circumstances.
Those are excellent points. Now, if someone is interested in learning more, are there any resources you recommend for reliable information?
Absolutely. The American Urological Association is a fantastic resource.
Okay.
Their website has a wealth of information about penile prostheses and other treatments for ED.
Got it.
It's a great place to start your research.
That's incredibly helpful. Now, before we wrap up this part of our deep dive, I think it's important to acknowledge that we've covered a lot of ground, but there's always more to explore.
You're absolutely right.
The field of men's sexual health is constantly evolving, with new research and advancements emerging all the time.
Exactly.
So if this is something you're dealing with, I encourage you to continue your research consult with qualified healthcare professionals and stay informed.
And remember, seeking help for erectile dysfunction is a sign of strength and self-care, not weakness.
Yeah.
There are effective treatments available, and there's absolutely no shame in getting the support you need to improve your sexual health and overall well-being.
Beautifully said.
Thanks.
And on that note, we'll wrap up part 1 of our deep dive into penile prostheses.
All right.
Join us for part 2, where we'll delve deeper into the surgical procedure itself, what the recovery process looks like, and what you can expect after the implant.
Sounds good.
We'll also touch on some of the psychological considerations that come with getting a penile prosthesis, and we'll try to address any other questions that might be lingering in your mind.
Great.
Until then, take care.
Welcome back to the KenkoVibe podcast. We're picking up right where we left off in our discussion about penile prostheses.
That's right. In part 1, we talked about what a penile prosthesis is, the different types, and how those inflatable implants work. Now let's shift gears and talk about the actual surgical procedure.
Okay.
I know it can sound a bit daunting, so let's break it down and demystify it a bit.
I think that's a great approach. It's important to remember that this is a fairly common procedure performed by urologists who specialize in this area.
Okay, so we're talking about seasoned professionals,
Yeah.
not someone who just dabbles in penile implants in their spare time.
Right. Exactly. This is their area of expertise. The surgery itself is typically done on an outpatient basis, which means you can go home the same day.
Oh, so no overnight stay at the hospital.
Yeah.
That's good news for anyone who's not a fan of hospital food.
Definitely a perk. The procedure usually takes about an hour. The surgeon will make an incision either where the penis meets the scrotum or in the lower abdomen, depending on the type of implant and the surgeon's preference.
Okay, so that's where they insert the cylinder's reservoir and pump.
Yes, the components are meticulously placed and then the incision is closed. You'll receive pain medication after the surgery, and your doctor will give you clear instructions on how to care for the incision site.
Got it. So what's the recovery process like? How long before someone can, resume normal activities, including intimacy?
Well, that's probably a question on a lot of people's minds. It's important to take things slowly at first and allow your body to heal properly. Most men can resume normal, non-strenuous activities within a few weeks, but sexual activity is generally off limits for about 4 to 6 weeks.
Okay, so a bit of patience is key. But once you get the all clear, is it pretty much business as usual in the bedroom?
Yes, once you're fully healed, you should be able to achieve an erection whenever you choose by using the pump. And as we discussed earlier, the implant itself doesn't affect sensation or orgasm.
That's reassuring. Now, we touched on potential risks earlier, but are there any long-term complications we should be aware of?
As with any surgery, there's always a slight chance of infection. Sometimes the device itself can malfunction, which could require additional surgery. But with proper care and regular checkups with your doctor, these risks can be minimized.
So regular follow-ups are important. Now let's shift gears for a moment and talk about the psychological aspects of getting a penile prosthesis. I imagine it can be a big decision for men, both physically and emotionally.
Absolutely. It's important to acknowledge that there can be a range of emotions involved, from anxiety and uncertainty to hope and even excitement. Some men may feel a bit self-conscious about having an implant, while others may feel empowered by regaining their sexual function.
It sounds like a very individual journey. What advice would you give to someone who might be struggling with the emotional side of this decision?
First and foremost, remember that you're not alone in this. Many men go through similar experiences. Talking to your partner, friends, family, or even a therapist can be incredibly helpful in processing those feelings.
Sharing your feelings and seeking support can make all the difference. Now, before we wrap up this part, are there any key points we haven't touched on yet that our listeners should know about?
Well, one question that often comes up is whether a penile prosthesis will affect the size or shape of the penis.
Ah, yes. I bet that's a concern for some men. So what's the answer? Does it change the appearance?
The good news is that the implant is designed to fit within the natural contours of the penis. It shouldn't significantly alter its appearance.
That's good to know.
Huh.
I think we've covered a lot of ground in this part, exploring the surgery, the recovery, and even some of the emotional aspects. Any final thoughts before we move on to part 3?
I'd just like to reiterate that if you're struggling with erectile dysfunction, don't hesitate to reach out for help. There are safe and effective treatment options available, including penile prosthesis. And regaining that sexual function can have a profoundly positive impact on your overall quality of life.
That's a powerful message. Okay, everyone, we'll be back shortly with part 3, where we'll delve into some real-life stories of men who've chosen this path, and we'll address some frequently asked questions about penile prosthesis. So stay tuned. Welcome back to the KenkoVibe podcast for the final part of our deep dive into penile prosthesis. We've covered a lot of ground, from how the devices work to the surgery and recovery.
Exactly. And we know you might still have some questions.
Yeah.
In this last part, we're going to tackle some frequently asked questions.
Okay.
And share a few real-life stories to illustrate what it's like to live with a penile prosthesis.
Sounds like a plan.
Yeah.
So what are some of the most common questions you hear from men who are considering this option?
One that comes up all the time is about the longevity of the implant. You know, men naturally want to know how long they can expect it to last.
That makes sense. It's a big decision, so people want to know what kind of investment they're making.
Yeah.
So what's the typical lifespan of one of these devices?
Well, like any medical device, it's not going to last forever.
Right.
But the good news is that modern implants are built to be durable and reliable.
Okay.
The average lifespan is somewhere between 10 to 15 years.
Okay.
Some men might need a replacement sooner, while others might go even longer without any issues.
That's reassuring to hear. Now, we've talked about using the pump to achieve an erection, but what about the deflation process?
Right.
Is it as simple as pressing a button, or is there more to it?
It's actually very straightforward. Remember that release valve on the pump we talked about earlier?
Yeah.
All you have to do is apply gentle pressure to that valve, and the fluid will flow back into the reservoir, deflating the penis naturally.
Okay, so it's designed for ease of use. That's good to know. Now let's get to those real-life experiences. Have you had any patients who are willing to share their stories about how the implant has changed their lives?
Absolutely, and their stories are often incredibly inspiring. I had one patient, let's call him John, who had struggled with ED for years. It really took a toll on his self-esteem and his relationship with his wife. After getting the implant, he told me it was like a new chapter in his life.
Wow.
He was able to regain his confidence, rebuild intimacy with his partner, and it honestly made a world of difference.
That's so wonderful to hear. It's amazing how such a small device can have such a huge impact on someone's life.
It really is, and John's story isn't unique. Many men report a renewed sense of masculinity and self-assurance after getting a penile prosthesis. It can be a very empowering experience.
That's so important to hear. It really underscores that seeking treatment for ED isn't something to be ashamed of. It's about taking control of your health and well-being.
I couldn't agree more. It's a proactive step towards living a fuller, more satisfying life.
Well said. Before we wrap up our deep dive today, is there any final advice you'd like to share with our listeners who might be considering a penile prosthesis?
I think the most important thing is to gather as much information as you can and have a really open and honest conversation with your healthcare provider.
Yeah.
They can help you weigh the pros and cons, address any concerns you have, and ultimately determine if a penile prosthesis is the right choice for you.
That's excellent advice.
Yeah.
Remember, knowledge is power. Making informed decisions about your health is crucial.
And don't be afraid to advocate for yourself. If you're experiencing ED, you don't have to suffer in silence. There are solutions out there, and seeking help is a sign of strength, not weakness.
Couldn't have said it better myself. Well, that brings us to the end of our deep dive into penile prosthesis. We hope this episode has been informative, insightful, and maybe even empowering for some of you.
Yes.
We've covered a lot of ground today, but if you're looking for more information, remember that the American Neurological Association is a great resource. And of course, if you have any personal concerns, please don't hesitate to reach out to a qualified healthcare professional.
Thanks for listening.
Thank you for joining us on this episode of the KenkoVibe podcast. I'm Ethan Reed.
And I'm Grace Morgan.
Don't forget to subscribe, like, comment, and share this episode with anyone who might find it helpful. Until next time, stay healthy and keep those good vibes flowing.